Hello everyone, you are watching this video because you have 5 weeks pregnant or you want to learn more about pregnancy. Congratulations firstly. You can be very happy because you are pregnant. You may worry about whether everything will be normal. You may have fears about birth, or you may not be sure of yourself as an expectant mother. Don't worry. All of these emotions are completely normal. Keep your mind busy by learning something about pregnancy, dreaming about your baby's birth at these moments. Before starting the video, like this video and subscribe to my channel to support me. Let's talk about what happens to you and your little baby in this week. First, let's check the titles of this video. Symptoms, pregnancy test, changes in your body, your belly, baby size, baby development, baby ultrasounds, and things to do. First topic, symptoms. These weeks are generally known as the weeks when some symptoms began. You may feel mild or severe nausea and tenderness in the breasts. Some lucky expectant mothers do not feel nausea during pregnancy. You may also experience emotional changes during these weeks. This is quite normal, and you can continue to experience these emotional changes in the following weeks. You should stay calm and don't forget to get support from your family and your doctor. The feeling of sleepiness and tiredness are also common symptoms in expectant mothers. Some expectant mothers do not want to get out of bed. Frequent urination in the 5th week of your pregnancy. The reason you frequently urinate is that the HCG hormone increases blood flow to your pelvic area and kidneys, and therefore it works more frequently. To prevent this, never reduce fluid intake, because you will need fluid all the time during pregnancy. You may not consume some drinks which can cause you to urinate frequently, just like coffee. And the last thing, this week you may have symptoms such as excessive drooling, craving, and disgust from foods. These are quite normal pregnancy symptoms in this week. Changes in your body. The first change in your body this week will be missed periods. However, some women may experience bleeding during this period. Some of the pregnant women may experience bleeding in the first 3 months of pregnancy. This is also known as implantation bleeding. You might also spot a bit after sex, since your cervix is more sensitive now that you are pregnant. However, these bleedings may indicate any ectopic pregnancy or cervical inflammation. It's highly recommended to talk to your doctor in case of bleeding during this period. Aching breasts may actually be the most common symptom at 5 weeks pregnant. Hormones are kicking into high gear to get your uterus started on making a baby, and this can cause really tender breasts. Pregnancy tests. Let me say from the beginning that I will make a detailed video on this subject. I will put that video here. So, in this video, I will briefly talk about the pregnancy test. When to take a pregnancy test, there are many reasons for missed periods. But if a woman is sexually active, a missed period can be a signal of pregnancy. A woman who has menstruation regularly can perform a test after the 6th day of her missed period. Most pregnancy tests are very accurate when taken after a missed period, but sometimes the hormone levels might not be high enough to trigger a positive result. It's possible to get a negative result from a home pregnancy test when you are actually pregnant. This is also known as a false negative. You might get a false negative if you take the test too early. Belly. This week, it's hard to spot a pregnant belly by this time. As you begin to gain a little weight, many women feel bloated, but as the weeks progress, you will actually gain weight. Relax, it's only the beginning of your journey. Just enjoy your pregnancy. Baby size, your baby is growing. Now in this week, your baby is as big as an apple seed. Your baby is now measurable thought at this week. It's now 0.13 inches. Baby development. Your baby, which is as small as a point in the 5th week of pregnancy, is ready for miraculous transformation in order to grow within you. It's a very near embryo yet. The cells in the embryo come together to form the neural tube. During this period, the body tissues and organs develop from the 3 primary gam layers that form during the growth process of the human embryo called ectoderm, mesoderm, and endoderm are formed. Ectoderm is the layers that forms the nervous system, spinal system, ears, eyes, connective tissues, inner ear, skin, and hair of the baby. Mesoderm forms the circulatory system and internal organs. Again, these layers provides the formation of muscles, bones, reproductive organs, and kidneys in the future. Layers that forms the internal organs such as thyroids, pancreas, the lungs, intestines, and bladder. The first stages of the 2 tissues that make up the brain have begun to form. The 5-week-old baby took the image of a tube from the brain to tail. Organs begin to form through this tube. At the 5th week, the embryo continues to grow inside a fluid-filled bubble called the amniotic sac and grows inside this sac during pregnancy. For several weeks, the baby is fed only by a membrane-covered tissue called yolk sac. We will also make a detailed video about placenta and yolk sac. For now, you just need to be familiar with these words. The placenta has formed in its precursor form and has started to carry oxygen to your baby. Baby ultrasounds. Expectant mothers wonder if the baby will seen on ultrasound in this week. But generally, if you don't have a medical history that puts you at higher risk for pregnancy complications, you won't likely have a 5 weeks pregnant ultrasound. You will just have to wait impatiently. We feel your pain. The first ultrasound is usually done by vaginally for a healthier assessment of pregnancy. Since the baby is a rapidly growing set of cells, it's seen as a tiny white spot on ultrasound. The 5-week-old baby looks like a tiny frog in an ultrasound image. It's likened to a shrimp image since it started to take a shape of C at the end of this week. Your doctor will calculate your baby's height on ultrasound. Heartbeats begin from the 5th week of pregnancy, but the sound will not be heard on ultrasound. The heart, the first organ start working, makes an average of 100 beats per minute this week. In this week, the spinal cord will begin to form in the part between the brain and tail. Things to do. Approximately 2 months after 5 weeks of gestation are critical weeks for neural tube development. Therefore, if you have not started folic acid supplementation before pregnancy, you should take folic acid pills when you find out that you are pregnant in the 5th week. Folic acid is very important to prevent neural tube defects in the baby. For the healthy development of the neural tube, which is a structure that also includes brain tissue and spinal cord, you are advised to take 400 micrograms of folic acid a day while you are trying to get pregnant and until the 12th week of pregnancy. Not smoking is one of the best things you can do for you and your baby's health. Also, we will make a video about this topic. So, quit smoking. Save a to-do list to keep track of things to do, such as taking folic acid and getting free dental care. This will make it easier for you to remember what needs to be done during pregnancy. Eating nutritious diet during pregnancy is linked to good fetal brain development, a healthy birth weight, and it reduces the risk of many birth defects. Good nutrition is thought to help balance mood swings, and it may improve labor and delivery as well. A well-balanced pregnancy diet includes fruits, vegetables, protein, and omega-3 sources. We talked a lot of things about 5 weeks pregnant and baby. Don't forget to like the video and subscribe to my channel. Take care of yourselves. Bye bye!